Hello everyone, welcome to the another session of OrthoTV. This is Dr. Mahadevi Patil. I am a final year MPT student from Sancheti Institute for Orthopaedics and Rehabilitation College of Physiotherapy. My topic is responses and adaptation of cardiac system to exercise and training. In this talk, we'll going to learn about the acute and chronic changes related to exercise on the cardiac system. So cardiovascular responses to exercise, the acute responses, the acute changes are the responses of the acute changes are the responses to exercise. We are going to see this now. During exercise, oxygen demand increases sharply and more nutrients are used. Metabolic process speeds up and more waste is created. Numerous cardiovascular changes also occurs during exercises. All shares a common goal that they allow system to increase demand placed on it and carry out its function with the maximal efficiency. Looking specifically at the following: heart rate, stroke volume, cardiac output, blood flow, blood pressure, and blood. These all are the functions of the heart. So we'll see what are the responses on this. So we'll get to know what are the responses of the cardiac system on exercises. First is heart rate. Heart rate reflects the amount of work of heart to meet increased demand of body, which is engaged in activity. Resting heart rate, it is average 60 to 90 beats per minute. Before that, we'll see what is anticipatory response. So anticipatory response is before start of exercise, pre-exercise heart rate increases above the normal resting value in some individuals, called as anticipatory response. This response is mediated through release of neurotransmitter norepinephrine from sympathetic nervous system, and epinephrine and the vagal tone also decreases. So the resting heart rate should increase for the compensation. Heart rate during exercises. Heart rate increases directly in proportional to increase with exercise intensity up until point of exhaustion. So, what is the heart rate max? If the intensity of exercise is continuously increasing, then heart rate is continuously increasing up to that point, as the graph is showing, as the x-axis is showing the treadmill speed, while the y-axis is showing the heart rate. So as the treadmill speed is increasing, the heart rate goes on increasing, but it goes on increasing up to what point for a person? Let's calculate this with the help of the formula HR max, that is heart rate max. It is calculated by 220 minus age, or HR max is equal to, that is heart rate max is equal to T208 minus 0.7 into age in years. The first formula can give you some potential error. So the second formula is showing the most accurate. So the recent equation, the second one, it appears to be more accurate. We'll see what is steady heart rate. When the rate of work is held constant at submaximal level, heart rate increases until it reaches the plateau. This plateau is called as steady heart rate. So lower the steady heart rate is better the cardiorespiratory endurance. Then second is stroke volume. So stroke volume, it changes during exercise to allow heart to work more efficiently. It is major determinant of cardiorespiratory endurance. The stroke volume is determined by following four factors. First, the volume of blood returned to the heart, ventricular distensibility, ventricular contractility, aortic or pulmonary artery pressure. The first two indicate the filling capacity of the ventricle, and the second two indicates the ventricular ability to empty. So stroke volume is the amount of blood is getting out from the heart to the peripheral circulation. If the stroke volume is good, then it is showing that there is a good cardiorespiratory endurance. Stroke volume increases with increased rate of exercise, but only up to 40 to 60% of the maximal capacity. Uh, Stroke volume of upright position, it is 2 into stroke volume of the rest. As per when person is the rest, when the person is in rest, the cardiac output or the demand of oxygen and nutrients is not much. When the person is upright, there are some work of the work of the anti-gravity muscle increases, so the stroke volume should be increased to fulfill the demand. So the stroke volume of the rest, it is 2 into so the stroke volume of the rest, it is half of the upright position. So rest stroke volume, it is 60 to 70 ml. While exercising, the stroke volume can go up to 110 to 130 ml. In supine exercises, the stroke volume increases up to 20 to 40%. As it is showing in the graph, according to the first statement, the stroke volume increases with exercise rate of exercise, but up to 40 to 60% of its maximal capacity. So it is showing in the graph that it is increasing at the starting, but at some point it is getting plateau. It is not getting increased. We'll see increase in stroke. What are the factors which is causing? We'll see what are the factors which causing increase in stroke volume. Frank Starling law states that when ventricle stretches, more it contracts and more it generates force. The second is increase in ventricular contractility. So as much as the ventricle is contracting powerfully, the more amount of stroke volume is going into the peripheral circulation. And decrease peripheral resistance. So decrease in peripheral resistance, it means the decrease in resistance of the pulmonary and the aortic artery lead to decrease in peripheral resistance in peripheral and decrease in peripheral resistance from the arteries will allow the more blood from heart to the peripheral circulation. The next one is cardiac output. Cardiac output, it is the product of heart rate and stroke volume. It is it is calculated by the formula cardiac output is equal to stroke volume into heart rate. The resting value of the cardiac output is 5 liter per minute. The cardiac output increases with increase in exercise intensity between 20 to 40 liter. The cardiac output increases with increase in exercise intensity between 20 to 40 liter per minute. As we can see in the graph, as the work is increasing, the cardiac output goes on increasing. We'll see what are the overall changes in cardiac function as response to the exercises. During exercise, cardiac output increases primarily to match the need for increased oxygen supply to the working muscle. During initial stage of exercise, increasing cardiac output is caused by both heart rate and the stroke volume. But when level of exercise excesses 40 to 60%, individuals' stroke volume either plateau or increase slowly. Thus, the further increase in cardiac output is due to the heart rate. Then we'll see blood flow, redistribution of blood during exercises. Because we have a limited amount of blood in our body, we'll see how the heart is fulfilling the demand of the skeletal muscle while exercise. So the redistribution of blood to the areas with greatest need, this redistribution is done by sympathetic stimulation, which will constrict the vessels in undemanding areas such as digestive system and excretory system. The sympathetic stimulation in skeletal muscle stimulates the constrictor fiber in vessel decreases, and the sympathetic stimulation to the vasodilator fibers increases the vessel diameter. The metabolic rate increases, so the waste begin to accumulate, which increases acidity, carbon dioxide, and temperature. So these local changes triggers the vasodilatation through autoregulation, and the blood flow increases through local capillaries. The regulation of heavy temperature controlled in the same way, so that the heat builds up in the body must get dissipated to get this decreased sympathetic stimulation to superficial vessel cause them to dilate redirecting. So this figure is showing at rest how much is the cardiac output is going to what systems. At rest, the most of the blood is going to the kidneys for excretory system. But when person is exercising, the according to the intensity of exercise, so the more blood flow is going to the skeletal muscles, to the redistribution system that we have seen earlier. We'll see what is cardiovascular drift. So what is cardiovascular drift? So with prolonged exercises in hot environment at constant rate of work, stroke volume decreases gradually and heart rate increases while the pulmonary artery pressure also decreases. All this collectively is called as cardiovascular drift. We'll see how this cardiovascular drift occurs. As person is doing exercise, there is progressive increase in fraction of the cardiac output. Vasodilatation to the skin is there to lose the heat and attenuate the increased body and core temperature. The more blood is going to the skin for the cooling purpose and the less blood to the muscle and venous return. So there is decrease in the there will be less blood to muscle and venous return is also decreases. Small reduction in blood volume is there due to sweating also. So generalized shift of plasma across the capillary membrane into the surrounding tissue. All this lead to decrease in venous filling pressure. This decrease in diastolic volume leads to decrease in stroke volume. To compensate this, heart rate gets on increases to maintain the cardiac output. So this graph, it is showing what are the various responses according to the exercise. As we can see, stroke volume, which is in yellow line, it is it's sorry. This graph shows the various functions of heart, that is heart rate, cardiac output, blood volume, mean arterial pressure, stroke volume according to the exercises. We all can see what are the changes at the start of exercises and when the person is doing what is the progressively change in each function of heart during exercises. Next is blood pressure. The systolic and diastolic blood pressure show different changes during exercises. The systolic blood pressure at rest, ideally it is 120 mm of Hg, and during exercises it can go up to 200 mm of Hg. The systolic blood pressure increases due to increase in cardiac output that accompanies increasing rate of work. It helps to drive blood quickly through the vasculature. The diastolic blood pressure reflects in artery when heart is at rest. It will not increase during exercise. Blood pressure in steady state during blood pressure is in steady state during endurance exercises. As intensity increases, the systolic blood pressure increases while the diastolic blood pressure will be constant. If sometimes decrease in systolic blood pressure, then it is normal response which reflects increase in arterial dilatation in active muscle, which decreases the total peripheral resistance. Second is blood. As metabolism increases during exercises, there are some changes which occurs in the blood. So first is oxygen content. There is some amount of oxygen in the venous blood also. So the arterial mixed venous oxygen difference, it gets on increases while doing exercises, because when as there is some amount of oxygen is present in the venous blood also, due to the increased demand of oxygen to the skeletal muscle, the all oxygen is absorbed uh, due to the increased demand of oxygen to the skeletal muscle. All the oxygen is used uh, by the all the oxygen is used by the skeletal muscle while doing exercises. So the arterial mixed venous oxygen difference is gets on increases when the person is doing exercise. With the help of Fick principle, we'll get to know how much amount of oxygen is utilized during exercise. It is given by the VO2. VO2 is equal to cardiac output into arterial mixed venous oxygen difference. Or we can calculate this by VO2 is equal to stroke volume into heart rate into oxygen mixed venous oxygen difference. Or we can calculate this by the second formula, that is VO2 is equal to stroke volume into heart rate into arterial mixed venous oxygen difference. Then second is we'll see what are the changes occurring in the plasma volume. With the onset of exercise, immediate loss of blood plasma volume to interstitial space. This is due to increase in blood pressure, increase in hydrostatic pressure, metabolic waste causing osmotic pressure, and sweating. All this leads to decrease in plasma volume. Then hemoconcentration. When the plasma volume decreases, the plasma concentration occurs. The hemoconcentration increases the red blood cells concentration substantially by 20 to 25%. Hematocrit can increase from 40 to 50% during exercises. As hematocrit increases, the amount of red blood cells per unit of blood pressure cells are as hematocrit increases, the amount of red blood cells per unit of blood because the cells are more concentrated. So as RBC concentration increases, there will be increase in the blood per unit hemoglobin content. Then blood pH. It changes significantly during exercise, becoming more acidic. From 7.4 to 7, the muscle pH decreases even further due to increase in lactate accumulation with increase in exercise intensity. So when person is doing exercises, the pH from 7.4 it can go to the acidic due to hemoconcentration and the plasma concentration. This diagram is showing the what are the overall responses and how the redistribution of the blood occurring during how the redistribution of blood is occurring when person is doing exercises. The next part is we'll see what are the adaptation of cardiovascular system to exercise. We will look at the changes particularly in heart rate, stroke volume, heart we will look at in the adaptation of cardiovascular system to exercise. We will look at the changes in heart size, stroke volume, heart rate, cardiac output, blood flow, blood pressure, and blood volume. So heart size in response to increase in work demand, the heart mass and the volume increases with the training. Extent and location of changes in heart size depends upon the type of exercise performed. During resistance type of training, the left ventricle must contract against the high blood pressure in systemic circulation. With endurance type of training, left ventricular filling increases due to training induced increase in plasma volume that increases the end diastolic volume. So this graph, it is showing that there will be increase in the size of heart according to the person when doing the activity or the type of exercises. So we'll see. Uh, Here is the categorization of runners, cyclist, and the strength athlete with the control group. And in the every type of exercise, it is showing that there is increase in the heart size as compared with the controls. Second is stroke volume. Stroke volume shows overall increase during exercises when the person is fully trained. The overall increase in stroke volume is due to increased plasma volume and forceful ventricular contraction. This graph, it is showing that the pre and post training effect of stroke volume and exercise. So as treadmill speed goes on increasing, the pre-training we saw that there is at some point there is plateau in the stroke volume, but post training there is increase in the stroke volume up to but in the post training we'll see there is increase in the stroke volume and there is no any plateau. Then heart rate. As we see in the responses or in the acute changes, the heart rate was goes on increasing. But in the post training period, the heart rate the heart rate will not increase more. The stroke volume is stroke volume. Sorry, heart rate. So in the post training period, the heart rate it will goes on increasing, but it will not goes on increasing more. The stroke volume will goes on increasing more. As we can see in this figure 9.6, the pre-training and post-training heart rate. So in the post training there is steady increase in heart rate and some point there is plateau to the heart rate. At this point the heart rate will not get increases, but in pre-training period the heart rate goes on increasing according to the load kept on the cardiac system. As well as the heart rate recovery, it is more as well as the heart rate recovery, it is more good the as well as the heart rate recovery, the heart rate recovery is more good in the uh, post training period than the pre training period, which is showing in the graph 9.7. We'll see cardiac output. Cardiac output remains unchanged during rest, but at maximal levels of exercise, the increase in considerably due to increase in maximal stroke volume. The maximum cardiac output changes from 14 to 20 ml in untrained people to 25 to 30 ml per minute in the trained people. Blood flow. The next is blood flow. Increase in blood flow is the most important factor for increase in aerobic capacity and endurance. The increased blood flow results from four factors: increased capillarization, greater opening of extensing capillaries, more effective blood distribution, and increased blood volume. Second is blood pressure. So, what is the response of blood pressure to the trained people? Resting blood pressure is generally reduced by the endurance training. The endurance training in reduction in blood pressure at the same submaximal work rate. At maximal rate of work, systolic blood pressure is increased and the diastolic blood pressure is decreased, as it is seen same in the pre-training period. Then blood volume, plasma volume, red blood cells and VO2 max. Blood volume increases as a result of endurance training. There will be increase in blood volume initially by its increase in plasma volume. The red blood cell is also increases, but the more increase in the plasma volume is typically higher, resulting in relatively greater fluid portion of the blood. Increased plasma volume decreases blood viscosity, which will improve the circulation and the oxygen availability. Research has shown that there is change in plasma volume are highly correlated with the change in the stroke volume and VO2 max, making the training induced increase in plasma volume is one of the most significant training effect. So in this diagram, we can in this diagram diagram, we are able to see as the days of training increases, what all the changes are happening in the, what are the changes are happening in the blood volume, plasma volume, and red blood cells. In this diagram, it is showing that what are the changes are in this diagram, it is showing that what are the changes are occurring according to the days of exercise or the days of training are there. So in the initially in between So, so in the x-axis, it is showing the days of exercise training, and the in y-axis, it is showing percentage change in these factors. So, the according to the training you get when the person is doing training, according to the days of training are increasing, the blood volume, plasma volume, and the red blood cells are getting in a constant manner. But initially, there is a lot of changes in there is increase in plasma volume steadily and there is decrease and then it becomes plateau. Same goes with the plasma volume. It goes on increasing and then it becomes plateau. But the red blood concentration, it is steady at the some stage. It's steady at the start of the exercises and it increases after some point of the training and it gets plateau after the exercise. Thank you. These were the acute and chronic responses of the cardiac system to the exercises. I hope this information is useful to you.